An influx of non-emergency visits to the emergency department at United Regional is really putting a strain on resources.
Yeah, and tonight's Healthy You, I show you why healthcare providers are encouraging patients talk with their doctor first before entering the CarePlus clinic or the ER. It's in the name. The emergency department is for emergencies.
Over the last month, about a third of our patients have had minor illnesses, some of them related to COVID symptoms that were less emergent and could have waited until the next day to go to their family physician.
Resources are limited and clogging the system isn't the answer.
When you have a true medical emergency, you want those ER providers, staff, and those rooms to be available. You want those resources to really be allocated and safe for those true emergencies.
United Regional officials encourage patients first reach out to their primary care physician before visiting the CarePlus clinic on Barnett Road or the emergency department.
The PCPs know patients' medicines, medical history, risk factors. Many PCPs are doing telemedicine visits. They can do a visit over the telephone and order the test, develop a treatment plan.
They're working to keep beds open and resources readily available.
We're starting to see our regular patient volumes coming back from the first surge of COVID, but we're also seeing more COVID patients coming in too.
We've obviously have seen an increase in testing. We are experiencing long wait times.
Because of this, the testing tent behind the Barnett Road Medical Building returns, something patients should take advantage of before entering the clinic or hospital.
We want to try to keep patients that are having COVID symptoms outside of the clinic. That just protects the health and safety of our staff, our providers, and the other patients that are not experiencing COVID symptoms. We have a registration area where they pull up. It's called curbside testing. They call the number that's listed, that's how they register, and then they drive around to the tent in the back of the building to see a provider.
The ER is reserved for those in distress, those with minor symptoms such as loss of taste or smell, slight cough, and sore throat should not call 911 or make a trip to the emergency department.
That congests the ER and doesn't allow for the resources and increases the wait times to be seen for everybody across the board. There's an increase in medical need everywhere. So coming to the emergency room needs to be reserved for true emergent care.
Reserving space and resources as United Regional works tirelessly to provide essential care. Now, because of the current COVID-19 climate, vaccinations at the CarePlus clinic are now by appointment only. Walk-ins are no longer available.
United Regional highly encourages you to go ahead and get that vaccine before trying to go to the CarePlus clinic too. If you're having symptoms, go ahead and just visit that testing tent.
Yeah, and we have the hours for you on our website.